Lesions of the visual pathway. Lesions of the visual pathway usually cause defects in the visual field and diminution of visual acuity, depending on the site of lesion. Hemianopia, amblyopia, amaurosis. Hemianopia. Hemianopia is a condition of loss of half the field of vision of both eyes. Etiology. Lesions in the visual pathway may be commonly due to number 1 trauma, for example, injury by the falls on the back of the head, gunshot wounds. Number 2 tumor, for example, cerebral tumor, pituitary gland tumor. Number 3 vascular lesions, for example, aneurysms, atheroma of carotids, cerebral thrombosis. Number 4 inflammation, for example, meningitis, chronic arachnoiditis, encephalitis. Number 5 degeneration, for example, multiple sclerosis. Types: homonymous hemianopia, there is a loss of right or left half of binocular field of vision. Lesions of the occipital lobe often result in homonymous hemianopia with sparing of the fixation area. Site of lesion, optic tract, optic radiations, and occipital lobe. For example, vascular lesions. Bitemporal hemianopia. There is loss of both the temporal fields. Site of lesions, lesions of the central part of the optic chiasma. For example, pituitary tumor aneurysms. Binasal hemianopia. There is loss of both the nasal fields. It is a rare condition. Site of lesion, lesions situated on the either side of the optic chiasma, destroying the temporal fibers of each retina. For example, distension of the third ventricles, atheroma of the carotids or posterior communication arteries. Amb- amblyopia, blunt. There is a partial loss of sight in one or both eyes in the absence of ophthalmoscopic or other marked objective signs. It is basically a deprivation phenomena whereby fixation reflexes are not developed. Etiology: unilateral amblyopia, congenital error in visual pathway, cycle suppression of the retinal image. Amblyopia ex anospia. High refractive error. It is curable with suitable spectacle in early life. Retrobulbar neuritis. There is the acute inflammation of the optic nerve situated behind the eyeball. Bilateral amblyopia. Toxic amblyopia. Optic nerve fibers are damaged by the exogenous poisons, for example, tobacco, ethyl alcohol, etc. Hysteria. It is due to psychogenic cause. It exhibits protein manifestations such as characteristic spiral visual fields, blinking, blepharospasm, etc. Number 3. Amaurosis dark. There is a complete loss of sight in one or both eyes in the absence of ophthalmoscopic or other marked objective sign. Etiology: unilateral amaurosis. Amaurosis fugax. There is sudden loss of vision due to embolization of retinal circulation. The episode lasts for few minutes. Cardiovascular abnormalities such as valvular defect, arrhythmias, migraine. There may be vasospasm of retinal vessel. Gaze-evoked amaurosis, transient loss of vision, occurs in a particular direction of eccentric gaze. Bilateral amaurosis, uremia. It occurs in acute nephritic and chronic renal disease due to circulation of toxins which act on wheel centers. Meningitis, encephalitis, the wheel pathway and center are affected. Hysteria, psychogenic aspect of the disease, is often treated, but great care is taken to eliminate any organ disease. Leber's congenital amaurosis, retinal aplasia. It is characterized by reduced visual acuity, head nodding, and nystagmus.